So unfortunately, it doesn't seem like I'm gonna get through a shift without at least one of my patients having or developing preeclampsia or triaging a preeclampsia rule out. So let's go ahead and talk about it. If you're new here, hi, my name is Bree. I'm a 29-year-old labor and delivery nurse, and I am your laborhood bestie. Make sure you're following along for all things labor and delivery. Now let's talk about the clamp. Last night I had a patient that had preeclampsia that developed into HELLP syndrome. So this video is gonna be talking about that in particular. So preeclampsia is a condition that typically develops after 20 weeks gestation. The most common symptoms are high blood pressure, sudden swelling of your hands, face, legs, feet, quickly gaining weight, right upper quadrant pain, kind of right up under your right breast, extreme nausea or vomiting, shortness in breath, a severe headache that doesn't go away with hydration, nutrition, and rest, decreased urine output, and vision changes. These are all symptoms that you should never ignore during pregnancy. Your body is communicating levels of extremely high stress. Preeclampsia begins as a disease of the placenta. When the blood vessels in the placenta do not form the right way, it affects blood flow to and from the placenta. And because our bodies are made up of systems that all work together to keep us healthy, if blood flow is compromised in any particular way, it can cause stress on some of your other organs like your liver and your kidneys and cause them to be overworked, causing them to not function properly. In the event that your preeclampsia does get severe, it can develop into something we call HELLP syndrome, which stands for hemolysis or a breakdown of red blood cells, elevated liver enzymes, and low platelets. And you do not need to have all of the symptoms of preeclampsia in order for it to develop into HELLP syndrome. If you have severe nausea and vomiting, you just feel really off, that right-sided rib pain is excruciating. Without having a high blood pressure, it can be that your preeclampsia has already developed into HELLP syndrome. Preeclampsia can be extremely dangerous for mom and baby. So if you're pregnant and you ever develop any of those signs and symptoms, please call your OB, okay? Or if you have questions and you can't get a hold of your OB, go to the emergency room, okay? Now, the only treatment for preeclampsia and HELLP is ultimately to deliver your baby and your placenta. But that doesn't mean that you can't still have a safe delivery. Let me know what questions you have in the comments. Bye.